NoviLens by Nova Systems can be used in a number of applications within healthcare. In this video, I'm going to review 3 different dashboards that were developed to answer different questions within the healthcare setting. The first that you can see is the demographics dashboard, and this was designed to show how NoviLens may be used in a situation such as what we're experiencing now with COVID, where perhaps you want to notify patients within your practice that meet certain criteria and advise them to practice good social distancing. So in this case, what we're doing is we're going to select the different conditions. Let's say we can start with diabetics, so we get diabetes. And by the way, all of these visualizations you see, they're all done using drop-down widgets that are very easy to configure. We train your staff on how to build these systems. We can build them with you. But it's a really straightforward process that you can see by going to our website and looking at the tutorial. You don't have to be a programmer to do any of these things. I can do body weight. So if I go down to body mass index, I can contact or add those to the screening, so you can see we have those in here. They're added. Everything is dynamic. Let's say we are going to select people who are 65, and I'm going to make an assumption about the birth date of my oldest patient, and say they were 1920. Let's say 101 1955, and again it quickly breaks down those patients and identifies who they are and where they are, and if I have their phone numbers or email addresses, I can quickly send out an email to them. The point of this is it's very quick, and that it works with your EMR system to consolidate all of that data from those different tables and allows you to contact the patients quickly. There are other ways you may want to apply this type of system. Let's say if you wanted to do a clinical trial and find patients who meet certain criteria with regard to demographics, this provides an easy way of identifying those patients. Now, the next application I'm going to show you has to do with being a patient dashboard. Now, this is put together to show perhaps, let's say you have a clinic and you see a number of patients during the day. This is a way to get all that information beforehand for each patient and generate your own personal view for each one of those patients without having to scan through all the medical records. Your administration can run one of these reports every evening, and it would be available to you on your tablet. And what it provides is a dynamic interaction between the data in the EMR and the tablet, and displays the pertinent information about that patient. So if I went down and said, okay, let's see Mr. Anderson, I have now this view of all the conditions that he's had, observations, which are basically lab values and such. And if I wanted to specify one, I can just click here and it would tell me those things, or I could enter it into a search field and put those in. Procedures that he's had, and again when they occurred. So you have this available right at your fingertips. You don't have to go searching for it, and it can counter some of those frustrating moments when you're interacting with the patient, when you're asking them their history and they're getting frustrated because they've provided it before and you don't want to go through the aggravation of looking through the medical record. It's all there available to you, readily retrievable. You don't have to go searching around for it. So it's an ease of use thing, and it's a way to really filter information very, very quickly so that you can get more out of that interaction with the patient. Now, the third view I'm going to show you has to do with research. And imagine if you want to start looking at all of this patient information and seeing if you can correlate different diseases, let's say, with different lab values, and see, is there an indication that by combining different lab values you can improve the diagnosis of a given disease. I mean, this would be very helpful with COVID right now if you had those sorts of records. I'm going to do one really quickly to show you how this works, and this also makes use of the machine learning capabilities that are built into Novus Systems NoviLens. So we're going to start with two groups of patients, prediabetes and diabetes. Added those in. And while I'm not looking at the medications effects, but you could go through and say, okay, if I had these and I had these medications and I looked at lab values, are there differences between the lab values on treated versus untreated? The system can do things like that. Right now, what I'm going to do is say, let's get their glucose, their hemoglobin, A1C, let's see, total cholesterol, and creatinine. Let's see where the creatinine is. Sorry about that. All right. So when I have those values, what happens is I get a table that's generated. For machine learning, I export that table from the system, and we do this exercise in cleaning the table with an application that comes with NoviLens. Now, I come up here, the dashboards, and in machine learning, I would intake that data set. And in that data set, I see where I have the columns with regard to lab values, and I have the statistical breakdown of the data within that set, as well as the system goes through and it tests and it recommends the type of machine learning algorithm to use in evaluating the data. Again, this is all built into this system. Once that's done, I run the model with the data, and I can look at that model. Again, these are all different criteria that are used in the machine learning algorithm. And it presents me with the relative influence of each one of these lab tests on differentiating between whether or not a patient is diagnosed with either diabetes or prediabetes. And it tells me the relative importance of each one of those values. Overall, the model isn't great. It's only giving me a 66% accuracy score. Not the greatest, but what it does show you is how the system can be used to perform tasks like this. So what I've shown in this video are 3 different ways that you can use NoviLens within the clinic to address different concerns. They can be everything from helping an administrator get in touch with patients to doing research on the information regarding treatments and effectiveness of treatments, coupled with machine learning from data in your medical records. So the system is very powerful. I hope you found this video useful. If you have questions, you can contact us at novi.systems. Again, thanks for listening, and feel free to contact us.